So I am the clinical manager at BUMC, or Baylor University Medical Center. We've got a staff of about 130 clinicians, and they pretty much see all of the patients there in the hospital. I originally went to school to be a chemical engineer. And I think it was probably the second quarter in, I realized I do not want to be a chemical engineer. I want to move around, I want to interact with people. And I ended up taking one of those career tests to see, what career was good for me, and physical therapy was one of them, and I had never heard of therapy before in my life. My counselor had a friend that was a therapist at the local hospital and set up an appointment for me to go meet with him, and that's all she wrote. Well, one of the main things that I've appreciated about this entity is that it's therapy focused, and they have been able to empower us as therapists to do what we need to do for the patient, as well as for Baylor Scott & White. For my own professional development, I've been able to grow through different positions. I have been able to help others to grow as well within our clinical ladder. I have had therapists that have maybe started out in acute care, and then they decided, well, I think I want to try outpatient or rehab, so they've been able to transition there. And I've had some of them come back to acute care. So being able to do that but still stay within the same organization, I think is priceless. That there's a camaraderie that you find, that the therapists have, that we understand each other and we are looking out for each other. And then we just have the best interest of the patient in mind. Because that's, I think, why we all went into the field that we went into. We want to help the patients. And that's the fire that kind of keeps me going each day and coming back each day.